Welcome back, beautiful people. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York. I am your host, Zen Sams. Now, up in just a few, in our influencer segment, we have celebrity Dr. Roya Hassad. You can check her out on the internet at drroya.com. She has 3 New York locations, Long Island, Queens, and Manhattan. She has a rather huge following on social media. Check her out on IG at Roya Hassad with 2 S's. She is the medical director and founder of the Hope, Life, and Dream Centers, prominent anti-aging medical centers here in New York. Now, according to a recent report, the global anti-aging market accounted for approximately 112 billion in 2020 and is expected to reach 163 billion by 2028. Skin aging is a complex biological process influenced by a combination of factors such as age, exposure to ultraviolet rays, pollution, lifestyle-related factors such as smoking, restricted sleep, diet and nutrition, harsh soaps, stress and depression, etc. Repeated facial expressions, I'm guilty of that one, amongst others. Then we have a rising old population and an elevated consumer demand for anti-aging products. And of course, those are projected to boost the growth of the anti-aging market even further. Welcoming now is Dr. Roya. She's an award-winning family physician, educator, and philanthropist. I spoke to her briefly last week, and I can tell you that she's very passionate about anti-aging and regenerative medicine. She is affiliated with top-notch New York medical institutes, and she has been recognized as one of the top anti-aging physicians in the U.S. Welcome to the show, beautiful lady.
Thank you so much for having me in your show. I'm very excited, and I want to start by morning mantra today. I want to share every single day. I start my day with this phrase: I'm strong and healthy. I am full of nourishment and self-care. My immune system is strong. I am grateful that my health is always getting better and high energy flows through my daily. I will always remain consistent and continue to show love to my body the way it deserves.
Amen. Now, you are a celebrity doctor. You're Iranian by heritage, a trailblazer in your field, and you say that you treat patients as a whole, regardless if they are coming in for Botox or hair transplants. What are the biggest requests? Is it restoring their youth internally or externally, so to speak? Meaning, is your average patient asking you for aesthetical transformations with their appearance or internal ones?
Well, when they come to me, they're looking for enhance their health total body and health transformation. They coming for some aesthetic procedures, and then when I connect with them, we get through the root of their issue, and then I will approach that 360 degree, and we connect with their and address all their problems. So, and that's my niche. I truly believe body and mind are 100% connected. And when I want to deal with my patient, I want to connect with them. I will truly empower them emotionally and then address all their health issues as well.
Oh, you're a one-stop shop. I'm coming to you. Now, tell me, what is the most important anti-aging product?
Right now, PRP and non-invasive, procedures such as radio frequencies, or they're very, very demand. They're very, a lot of my patients requesting that because there is absolutely no downtime, and the results are fascinating.
And what is this PRP method anti-aging technique entail?
So PRP is platelet-rich protein. So a patient comes to us for different reasons. They may want to rejuvenate their face, their body, or they come for the hair loss. So we draw the blood and then we centrifuge it, we collect the plasma, and then in the plasma there are some growth hormones. So we introduce that by injecting this serum to their body, to their face, and to the area which they have hair loss. And what it does, it promotes the blood flow and then the growth of the cell. And you know, in 3 to 6 weeks, patients getting amazing result. Of course, with one treatment, one treatment is not enough. So I usually recommend 3 to 6 treatment with the interval of 4 weeks.
This is fascinating stuff. So you are drawing blood, and then this is from the patient, and then you're spinning it, basically extracting what you need to extract and then reinserting it into the problem area, basically, is what you said.
Yes.
Wow, this is where medicine has come these days. It's fascinating. Now, this is another interesting question, because this is affecting everybody, young and old. But the global diabetes devices market size was estimated at approximately 26 billion in 2020 and is expected to reach about 29 billion by the end of this year. How have you been successful in treating your patients with diabetes?
So as you know, we have two different type of diabetes, type 1 and 2. The most common one is type 2, which the insulin is, the body is resistant to insulin, which is produced in the body, versus type 1, which patient doesn't produce insulin because the beta cell in the pancreas is attacked by patient's immune system and it destroys, so patient don't have any insulin. So there are so many transformation in a treatment of diabetes. There are G1P1 receptors agonists are coming to the markets, and we have SGLT type 2. These are the new medications. The first one is basically they help the body to have less resistant to insulin. The second one is block kidney from reabsorbing the blood sugar to the body.
Now, is this a different approach than an endocrinologist would take, so to speak, or is this the conventional medicine that one would prescribe if you went to your endocrinologist and you had diabetes?
That's a conventional, but I want to add to this. There are, for the last 10 years, there are some innovative technology by a stem cell therapy came to the market, and a lot of doctors are interested to use the stem cell.
Wow.
The stem cell can be can contracted from the embryonic cell or can be contracted from the patient's body fat cell. And then what we can we purify it and then we reintroduce it to the body. And what it does is basically regenerate the pancreas, so the own body heal and produce insulin, or it can help the the downtime complications of the diabetes type 2, such as cardiovascular disease or kidney disease, will be reversed.
That's
It's fascinating.
incredible, fascinating stuff, Dr. Roya. I mean, you're at the really at the epicenter of all of these advancements and research, which is great. Now, very quickly, because we have about 2 minutes, I don't want to rush it, but this is important. The global alopecia market, which we're talking about hair loss, was valued at about 7.6 billion back in 2020. Now it's expected to expand at a compound annual growth, otherwise known as a CAGR, of 8.1% from 2021 to 2028. Now, according to the data published by the American Hair Loss Association, it stated that over 95% of hair loss in men is caused due to androgenetic alopecia. What proprietary methods do you use to treat hair loss in men and women? We have about a minute.
So as you know, there are different causes. The most common is hereditary, then hormonal imbalance, there's stress, some nutrition deficiency, some existing condition, radiation. But the most common, and then one of the most fascinating technology we use again for hair loss treatment is PRP again.
Back to PRP.
I mentioned to you. I also, when I see my patient, I have a full comprehensive evaluation. We go through the whole, the medical history, and then we discover if they have any underlying issues, we address that. And that's,
Beautiful.
yeah, that's very, that's very helpful to treat the hair loss.
No, this is incredible stuff because you are a one-stop shop. Literally, you are a doctor that addresses all areas. You look under the hood, you do your research, you get to know your patient, and that's what I love about you. Thank you so much for coming on the show. It was very refreshing talking to you because you are so scientific based, but you're also such a beautiful person inside that it made this interview it went from your average medical interview to something much more fun. So thank you for joining us.
Thank you so much. And the last thing I still truly believe love is the most powerful medicine. So I encourage my patient to love themselves and share their love with the world.
You got it. We're going to share our love right back at you guys. That is Dr. Roya. Check her out, drroya.com. Check her out all over social media. She's an influencer of sorts. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York. We'll be right back after this.